As promised, here is the information. We want to make sure we get it to you. The crisis line that you can call 24/7, 1-800-273-8255. The text line that you can try 24/7. Text TN to 741-741. And here is the correct web address to take one of those screenings and also get resources that way. MHAMidsouth.org. MHAMidsouth.org. I want to welcome back Tom and Jackie from Mental Health America of the Mid-South. Thank you all for being here once again. I think that we have touched on so much and such very vital information over the past hour. One thing that we haven't touched on, a lot of people probably went home for the holidays and not seeing family for a long time perhaps. They were shocked at how their parents are aging or maybe struggling being isolated. You all can help with that. Jackie, can you talk about that a little bit?
Carrie, yes, thank you so much for mentioning that. We do have someone on staff who can help with in-home visits and meet with caregivers in case they were a little surprised when they went home and maybe saw a parent, grandparent, aunt, or uncle who may be struggling a little bit through the aging process. It can be anything from looking at how your home is set up, or maybe the color of your rugs, or maybe it has something to do with your door handles and how they're shaped. Could be little things where you've placed calendars or clocks or certain items around your home where you can help improve the quality of life for that person who may be going downhill a little bit. She can also work with families and talk about just attitudes and questions, and helping you alleviate some of that frustration. Maybe for years you've just gone in and said, "Hey mom, what do you want for breakfast today?" Well, as mom starts getting some early dementia, maybe she can't pull pancakes out of her memory, and maybe she gets frustrated, and then you get frustrated because she's frustrated, and then there's a blow up. Maybe it's just changing that conversation where you say, "Mom, would you like cereal or would you like pancakes?" Give her a choice, give her a little bit of empowerment, and that'll help alleviate some of those blow-ups as well.
That's so very important.
Yeah. So, Tom, do you have anything to add?
Yeah.
Well, it's not just that person with Alzheimer's, but it's also that caregiver. In fact, I call it caregiver disease, because the stress and anxiety on them is so heavy sometimes. So we're always, knowing that we can help sustain them and build their resiliency and help connect them to the supports they need so that they'll be, good for themselves, good for their spouse, good for the others that they help. That's just so important. Lynn, she even does for aging communities a great free training called Mental Health First Aid, to help people with to identify resources, identify dementia, to train first responders on search and rescue for people who may have wandered away. And then they make, Carol in our office makes that free training also available for police, firefighters, and many others. Mental health first aid.
Tom, we only have about a minute and a half more, and I need you to kind of just sum this up for us, for someone who is watching and needs help, or has a family member who needs help and thinks, is this where I need to go? What is your message to them?
Yeah, listen, Mental Health America, that's our job, is to provide you referrals, provide you with factual information to get you at the right help for the right time, whether it's suicide prevention, children's mental health, Alzheimer's, suicide prevention, all of this, depression, anxiety, or screenings, they're free. So we hope that you'll take us up on this offer that the community has. We're fortunate to have an MHA affiliate here in Nashville. We're looking forward to serving anybody who calls.
I just love hearing from you all tonight, and I can just tell that door is open and there is an eagerness to help people, and I think that makes it so much easier for folks to reach out. And I hope someone or many people who are watching tonight feel that and can respond and can get the help they need. So Jackie and Tom, thank you so much for being with us.
Thanks, Carrie.
And I wish you a happy 2021. Hopefully it's a great year for all. We'll cross our fingers from this point out. All right, we're going to come back and wrap things up in just a moment, tell you what's on board the rest of the week. Stay with us.